Welcome to the nation. I'm NADIAH ABDUL. Bullying and mental health, two issues often intertwined yet often left unspoken. Today we discuss how to break this cycle with silence with AINI ALEGREA SUNYER, lecturer and clinical psychologist at the International Islamic University of Malaysia. Welcome to the studio.
Thank you, Nadia.
Let's talk about the larger frame of bullying happening to children. We know that recent figures show that there are about 16.5% of Malaysian children, and these are children between the ages of 5 to 15 who are currently facing mental health challenges. Coupled with growing visibility in bullying that we've seen in Malaysia today, what are these numbers telling us? What is this signaling?
Oh, okay. I would say that these numbers actually indicate that it's a national level crisis, right? That's number one. It is something that we should take action immediately. It's not something trivial, because if we take action, if there's a delay in taking action, it will definitely make the symptoms, like for example, symptoms of anxiety, depression, it will go from moderate to severe. And what would that mean? It would mean that they'll be suffering throughout their adulthood and young adulthood. Yeah.
And we're seeing that these cases, including school refusal, are linked to, things, for example, anxiety, depression, and unfortunately, most recently, loss of lives because of bullying. How should parents and educators interpret this warning sign? Because you did say that this is an urgent problem.
Correct.
But what should parents be aware of, or caregivers at least?
Okay. I would say that this particular issue, it needs to be looked into the deeper level, which means, like, let's picture an iceberg, right? An iceberg. So what you see on top is just a manifestation of so many things underneath. Mm-hmm. Like, for example, there's shame, there's guilt, there's bullying, or any kind of mental health issues that they're suffering that goes under the radar. So you don't see it. What you see is just the behavior of, like anxiety or depression.
So we're basically seeing somewhat like the symptom, but
Correct.
The root cause can be a lot of other things.
Correct.
Now, what should parents be watching out for if this, you say, are symptoms, and we should know that this is beyond just acting out and not wanting to go to school? So what are some of the symptoms that we should be looking out for?
Okay, they could be like bedwetting, they could be like crying before going to school, that you have to drag them to go to school. So any warning signs that shows that they experience anxiety in certain level, right? And they become dysfunctional. Usually kids or children, even adults, they would actually be dysfunctional in certain level that you can see or you can guess that, okay, there is something wrong that is going on here, that I need to look further.
Basically behaviors that are not common to the child, otherwise wanting to go to school.
Correct.
Now, in recent tragic cases, and this has of course included deaths, and it has sparked public outrage, we've even had a parliamentary town hall recently on this. In your view, what are some of the gaps that you're seeing, or events that expose in our protection, our prevention, and our enforcement systems?
Okay, I would say Malaysian government have done a lot in terms of preventing or in terms of intervention. However, I would like to emphasize on looking at in a holistic approach. For example, like psychoeducating parents in terms of what are the causes, what are the factors that contribute to bullying, what are the impacts of bullying, right? And teachers should be empowered as well on how to tackle bullying issues at school. And they should be looking at it in a way that everyone can get together and actually work together.
When you say everyone can work together, we do understand that in some schools we have the system Pembimbing Rakan Sebaya, right?
Yeah.
And I know that very often people say, okay, if this is a bullying case, just go to your peer support. How effective has that been so far?
Okay, I would say, even the Pembimbing Rakan Sebaya can actually experience mental health issues as well, because they are absorbing all this, right? So you can't be just saying, okay, you go ahead and deal with this. So it needs support from the teachers, from the institution, from the school itself. So that's why I said it needs to be holistic. It has to include parents, it has to include teachers, Pembimbing Rakan Sebaya, school leaders, so student leaders, for example. right? But we can't be saying that this is a one-man job. It has to be, everyone, has to be together and also like work together to eradicate this particular problem.
But this sounds like the children mental health issues like a ticking time bomb. There's so many different things that are happening at the same time. What risk do we face if we decide not to take this seriously and say, okay, they will pass, this period will pass? What are some of the risks that we should be aware of?
Okay, the risk of just dismissing it or really not paying attention to it, it would cost a lot. Okay, a lot here means, when you say ticking time bomb, right, it means what I interpret it as to be, the severe outcomes. That would mean self-harm, self-injury, and even suicide, unfortunately.
And we've seen this becoming something that is more prevalent. Do you feel that it's because there isn't channels where children can actually report, or is it because that they feel that they're unsafe? What do you think are some of the key factors why things can actually go to the extreme?
To that.
Yes.
Yeah. I do believe that we have channels, right? But I think there's still stigma. Stigma is really high still in terms of recognizing, expressing, on how to be safe. I mean, if I am a kid and I am scared to tell my parents even, that would hinder for me to, to even report to the teachers, because my own parents, they don't really actually believe me. So yeah, we need trust from the parents, right? Trust from the parents, a very effective reporting system in the school, right? Empowering teachers to handle or to tackle bullying issues in school, and also like the fear of speaking up. I think that needs to change as well.
I think there's been quite a lot of campaigns around trying to combat stigma relating to reporting, how to, have, you said trust, combating stigma, and really the reporting system. But we've seen cases, in fact, even the recent case where we had the death of the student, where the feedback is often, even if I report, it doesn't change anything, so I might as well just keep quiet. Correct. So it, to me, flags that this is a very layered challenge that is deeper than just, once I report, where does it go to?
Okay.
In your view, what are some of the things that, on the flip side, how can this effect of poor mental health actually drive students to perhaps one day be bullies themselves? If there's a situation where nobody helped me when I was struggling, I'm just going to become one. What are your thoughts?
Okay. Regarding the first point that you mentioned, or the statement that you mentioned, that what's the point of me reporting? Because I think that is the root problem that needs to be changed. Because if, again, I'm a parent myself, right? So if I feel that my children cannot even talk to me, then that is one of the things that needs to be changed first. So it starts from home. So the children should be able to feel they can trust their parents to say whatever that they need to say, or address any issues that they're going through at school, and then supported by the teachers, and changing or amending something, improving the reporting system, right? So that, I think that should be, it goes to the root problem, which means it starts from home. That's one.
Yeah.
And then you mentioned about the person who was bullied become the bully themselves.
Yes.
So there is an expression that hurt people, correct?
Yes, correct.
Yeah. So that's the thing. So sometimes some kids, they have a predispositional tendencies, to actually have this conduct problems, right? And coupled with environment or adverse childhood experiences, to nature and nurture together. And that could actually manifest in the behavior of bullying. So, and I'm not saying that that should be an excuse to bully, but we also need, again, remember the iceberg?
Yes.
So we need to look at the deeper level of the iceberg.
But that's very interesting, because you're saying that there's a nature versus nurture situation in this, and that some people perhaps have the tendency to express themselves in more aggressive ways. Is that what you're trying to say? Wow, okay. And we know that bullying are not only limited in schools. We know that it also happens at home, online. Cyberbullying is a huge thing, and work, How are these different environments affecting the ecosystem, and the change in the nature of harm and the challenges that we're seeing from young children to teens and adolescents to then of course adults.
Correct. It goes back to the first point I wanted to say. I mean the first question, right? So again, it starts. The root will be how do we raise our kids, right? How do they develop identity, and how do am I able to regulate my own emotions? So that starts from home. And these behaviors, or the way that I deal with people, this is how I'm going to bring myself to school. And this is how I'm going to relate to other kids. But then it would transition to adolescents, and then adolescents to adulthood. So unfortunately, if the help is not there, when the symptoms are moderate, it could extend to adulthood. Right.
And then bullying in the workplace is even harder to detect because
Correct.
they go under layers and layers of hierarchy and
Exactly,
dynamics.
yeah.
Now, what we're seeing in Malaysia right now is that silence still becomes a huge barrier, where you have a child that's being bullied all the way to when you become an adult or young adult that's being bullied, right?
Correct.
Many children don't speak up, you said, because of shame, fear, distrust.
Yes.
But how can we then cultivate these safe spaces? You did say that everybody has to work together, but how does that work together look like in making a safe space for children?
Okay. I think the culture needs to change. I mean, how we view, how we define bullying, how again, I mean, we can have so many campaigns, we can have so many initiatives, but the mindset or how we view things, if we don't change it, then nothing.
You said something interesting though. You said how we define bullying.
Correct.
I know that in some places, for example, in the boarding school system, they believe that it builds a bit of character.
Exactly, yeah.
Ragging builds character.
Correct.
But at what point does ragging slip into bullying, or is ragging a no-no? Where does this actually sit?
That's the thing. What is ragging actually? How does that toughen us up?
Exactly.
I think that is where the line should be drawn.
Okay.
Like, okay, even the saying, like, or we have an expression like ala sikit je,
Yes.
tahan sikit je.
Yes.
Even that one, when you say that to me, that means you're dismissing.
Yes.
You are not listening to me. You are not addressing my issue.
Or minimizing the harm
correct.
that I'm currently
Exactly. You're minimizing my pain and my suffering.
And so that in terms of what you've seen, just kind of perpetuates that level of, okay, there's no point, right, okay. How effective do you think the current Malaysian school systems, I know this is a thorny question, but how effective do you think Malaysian school systems are currently doing? How well equipped are they in supporting not only the students, but the caregivers and the educators?
Correct. I think it's pretty much effective.
Okay.
However, there could be some room for improvement. Yeah, for example, like like I mentioned just now, amending or doing a little bit changes in terms of reporting, right? That's one, okay. And then building a culture where it's okay to speak up. I think that is where we should start, because it's not. I think it's not a culture for us to actually tell people, you know what, I'm having this particular issue.
Yes.
I mean, human connection has died down pretty much.
A great deal.
Correct. And we have technologies.
Yes.
Like to if I'm feeling down, okay, maybe I can use ChatGPT to help me or anything like that. So that that actually stops us from reaching out and actually telling our parents or telling our teachers.
That's a very interesting point that you raised, because in the recent town hall we had, there were two things that came up. One was that children actually said that in the event of a bully or in the event of something happening to me, my go-to actually isn't my parents. I will ask chat.
Correct.
Because I feel that there is that layer of protection, right? And at the same time, when you say reporting or speak up, we do know that schools are trying. We've got schools that are now claiming to be sekolah anti-bully.
Correct.
Or sekolah bebas bully. Is there such a thing like a zero bullying school? Is that even possible?
It could be, but then again, going back to the part where if we don't change our mindset, it's just going to be a name then.
Yes, it's still good.
It stays there, but it doesn't, like really, it's not embedded. Like, even, like going up to people and saying, hi, how are you? That's not even in,
Let's start with that, right? Let's start with the basics.
Start with the
instead of
basics
saying-
first instead of like,
Agree.
yeah.
AINI, you've called for stronger status and access for psychologists and psychiatrists to also be able to go in and assist, right? What specific policy changes do you think would make the biggest impact in this space?
For psychologists and psychiatrists, I would say the presence of Psychology Act would
Sure.
actually elevate the status, yeah, in terms of like regulating, and standardization, and weeding out any pseudo-psychologists. That will be, very, very important. Yeah.
What's a pseudo-psychologist?
Okay. Pseudo-psychologists, again, usually would use methods like, I would say creative, is it safe to say this? Creative or unique methods
Right.
to actually treat clients or patients. Which is not necessarily, I'm going to emphasize on the not necessarily backed up by science.
Right, okay.
Yeah.
Faham. So beyond policy and beyond the practical steps that parents, young people themselves, the school system, etc., and communities can take to build a safer and more supportive environment, what more do you think we can do? You did say the use of technology, but I do understand that, if you compare Semenanjung and Sabah Sarawak, that use of technology and penetration is also different. So what are the ways that we can think of?
I think, again, we have to find ways to actually reach, a certain level of understanding on, okay, where shall we start? Okay, because again, like we can have all these policies, all these, avenues or channels or mediums to report or anything like that. But then again, at the end of the day, is it reachable to everyone? Is it affordable even?
I love that you mentioned that.
Yeah, for everyone.
So when we say reachable and affordable for everyone, right now, what is the current situation? I'm guessing not everyone can reach
Not
and not everyone can afford.
Can afford basically, like to pay or, even like having a session. It will be very challenging and difficult.
So with that, when you're talking about, reaching and affordability, we know that social media and online spaces has been sort of the frontier.
Correct.
A lot of mental health apps have always already, been out. In fact, even anti-bullying apps that you can download.
Correct.
How effective have you found those? Or should we actually be, as parents, should we actually be worried about those kind of things? Because we don't know what our children are actually looking at.
Okay, I think that's a very important point, because I think sometimes when we know a lot, we tend to compare our symptoms with what we read or what we see online, but it doesn't mean that it's actually valid.
Yes.
So we need to cross-check. That's why we need professional, mental health practitioners to actually diagnose us, not just referring to what ChatGPT or Google says.
I think the helicopter parenting style and the cross-checking is a minefield for parents, because some people will say, no, this will help toughen my child up, and sometimes they'll say, I just don't have the time to invest, right? But that's exactly it. It's a race against time if you're trying to say that this is a kind of a ticking time bomb.
Correct.
In your experience, if we were to compare some of the other countries in ASEAN, for example, do you have any examples of what other countries that have done well? What are some of the things that perhaps we can learn here, and what we're doing well that maybe other people can also do?
Oh, okay. I think there is one program. I think it's Kiva.
Kiva,
right, from Finland.
Okay.
So they actually, the whole idea is to have, again, the holistic approach. So it's a whole school program, right? It means that we need to change. It's not only focusing on the victims and also the perpetrators or the one who bullies, but it also focuses on, let's change the culture. Again, I'm going back still to that, because if we don't have the same level of understanding, if we have misconceptions, or if we are not in the same level, right, it's not going, unfortunately, it's not going to work.
Yeah. And if for a country like Finland, what are the, I suppose, guardrails for children who do bully? What does the law says? Is there punitive measures, or is it really focusing on building a society that's anti-bully to begin with? So we're not even talking about what happens when there is a bully kid.
Okay, I think that's a little bit idealistic to say that, it's going to be a school without, bullying issues. That would be pretty idealistic, right, to say. But, okay, punitive measures should not only be the way. I mean, they need to go through like therapy. That's one, Okay, they need to go for therapy. They need to be able to, again, because coming back, addressing back the roots, right? We need to really understand what's going on behind this mask of bullying.
If you look at what's happening in Malaysia, and I know earlier you talked about the government's effort in terms of trying to combat or develop this sasiah baru, the culture that we want to see. In the recent town hall that was had in Parliament, that was hosted by the Parliamentary Select Committee on Child Rights, there was a very interesting discussion from PIBG, from Sekolah Asrama Penuh, from boarding schools, from youth groups, etc. But they weren't the voices of the children in this discussion. They weren't the voices of the youth discussion, right? And a lot of them called for either more stringent measures to either demerit parents or bring back caning, or looking at ensuring that the burden of responsibility is actually in the home, right? At the same time, we're also seeing, unfortunately, our own leaders perhaps not necessarily walking the talk. And you mentioned rightly so that bullying happens everywhere.
Correct.
And in the last parliamentary session, we saw quite a lot of angry people discussing topics, right? But how do we mirror this forward, right? Beyond punitive measures of, if you are a child or a young person caught bullying others, and therefore there's either a sentence or a term or a correction, integration that's done for you. What are the things that we can actually do? You said culture, but in building that culture, I'm guessing it's not an overnight thing.
Of course.
So thoughts?
So again, it starts from home. Okay, how do we raise our kids? How do we make them emotionally equipped, right? Because again, in a collectivistic culture, there's always going to be shame, and there's going to be guilt, and there's going to be stigma. So how to go around it and say that yes, we have, this is the reality, but you can actually you can have a safe space, and you can actually speak up. So again, it starts from home, and then coupled with how teachers are being empowered on how to training.
Do you think religious institutions should get involved? For example, a lot of people go to, say, Sunday school or the masjid or khutbah. Do you see that there is actually a space in faith-based institutions to actually get involved in the conversation?
Yes, very much. Because again, we're looking at holistic approach. Again, it's bio-psycho-socio-spiritual.
Bio-psycho-socio-spiritual. Okay, we're going to make note of that.
Yeah, bio-psycho-socio-spiritual, which means it combines all different aspects. Right, so yes.
So finally, if I were to ask you, young people themselves, children and teens and young adults, how can they do better in supporting each other? You said helping to speak up.
Correct.
Sometimes it's not you reporting for yourself. It's sometimes you reporting for a friend or a sibling or a significant other. So how can they play an active role? And how can we support them to be able to be empowered to report when there's a problem?
Okay, I think it starts within ourselves first. So am I, capable to even regulate my own emotions? Because again, in order for you to help other people, you have to help yourself first.
Yes.
Right? So again, if you think you can intervene in that particular situation, right, then definitely we empower, you're not only a bystander, but you are an active one, which means you are able to report without feeling that fear.
Love that. Don't just be a bystander. And we have the bio-psycho-social-spiritual effort into ensuring that this is a holistic approach. Now, that's all the time that we have on The Nation today. Today's discussion is a reminder that no one has to face bullying or its impact on mental health alone. Breaking the cycle of silence takes courage, but together we can help each other heal and grow stronger. I'm NADIAH LATIF. Thanks for watching The Nation, and follow us for more in-depth conversation and topics that matter. Take care.
Thank you.